Dr. Dupree is going to talk about dry macular degeneration, modifying the risk, and other suggestions, particularly regarding symptoms in children. So it's now my pleasure to reintroduce Dr. David.
Figure the pointer out. Very good. Okay. All right. Well, welcome back from break. And again, there is some redundancy on some of these talks, and so some things we'll kind of breeze over and allow some of the different people to really focus in to where we can cover these things. But I don't mind repeating a few things of importance also, because I think with that repetition, we all learn a little better too. So if we are covering some, oh Larry, that's seriously, you just dip it right in, don't you? Nice. A new technique. Okay. Go ahead. So we just covered a lot of the epidemiology with Dr. Tolentino. I'm just going to touch on it a little bit again, just to recognize, you know, that we're every 3 minutes a new case, and each year 1.2 million people, new people, are suffering with this problem. So there's a tremendous amount of attention being given this, and that's a good thing. We don't want that super rare disease, because if we want industry and the pharmaceuticals and all these other companies to develop solutions to these problems, there's got to be enough people that sustain essentially their business model. And you hear a lot of controversy on things like Avast and Lucentis. Well, I put a plug in, I think, for the company. I mean, Genentech itself invested $500 million into developing these drugs, of which Dr. Tolentino had his hand in early on in the laboratory. He basically was in the laboratory and he was still in Pampers. And he was running around when I was in Boston, and we didn't quite know, but now I understand why. But basically, you know, these companies put a tremendous amount into their research, and they may be developing 5 different drugs at the same time. And 4 of those drugs may be duds and not work. And the one drug is kind of their home run drug, and it gets through the FDA, and it is safe, and it is efficacious. You know, it works. And so really, they have to, with that one drug, they have to stay in existence as a company. So they have to pay off all of their research bills, everything that went in all those failed attempts, and that gets wrapped up in that drug. And they go to the FDA, and the FDA goes through all the cost analysis of that drug. And what we're going to see here too is there's a tremendous cost savings to keeping people seeing. And you can't underestimate that. And we're going to go over a little bit of that. So I want you to keep in mind, when you hear about this drug that's, you know, very, very expensive, the company didn't come up with the pricing. Well, they influenced it, you know, as much as they could. I didn't come up with the pricing. Medicare agreed to the pricing. The insurance companies do. And they know what the cost is when people start to lose their vision. So that's all been factored in. And if we just run away from the company that spent the $500 million of their own money, my take on it is they won't come back to ophthalmology. They'll go off to oncology or some of these other areas and develop, you know, the drugs for those areas. So I think the pharmaceutical companies need a tremendous amount of respect, really, for the work that they've done. They've changed our whole, you know, the way we live and so on. And we don't all want to be taking tons and tons of pills and so on. But nonetheless, I would make a case in point that if we don't support the companies that build the drugs to cure the disease, they'll go elsewhere. They're not stupid. So anyway, you know, there's a lot of social impact from this disease. You know, depression and people getting hurt and tripping and falling. And, you know, I've had patients trip, fall, and lose their good eye, you know, hitting a curb. Breaking hips. So one Australian study showed, and this has been repeated in the US, but it showed for every $1 invested in the treatments for wet macular degeneration, there's a $2 savings. So, you know, we're all very fiscally minded on these things, but the most important thing is, you know, the goal is to keep people seeing and improve their vision, improve their lifestyle, keep them healthy, and you end up with a less dollars spent per person. So I think we got to put that in perspective when all we hear about is how much that drug costs. Well, how much did it save in that person's overall expenses to the system? Early detection, like anything, that can be much more cost effective. You know, if we get ahead of the disease, especially things like diabetes and all these other things, you know, if we get ahead of the disease and can really get on it, stabilize it, we're a lot better at doing that now than we were with a lot of these nutraceuticals and diet, exercise, and fish oils, and a lot of these things will be covered in our next talk on nutrition. You know, we impact that disease in a favorable way. We reduce healthcare costs in general. And I mean, I think that's how, you know, we should be approaching this. The level of awareness is pretty poor. Go ahead, Mark. And I thought this was kind of interesting. When they surveyed a public awareness study, 7,800 adults asked about AMD. 70% were not familiar with macular degeneration. Now, I think everybody in this room is, but this was just a general survey. Only 2% say they knew that AMD was the leading cause of severe vision loss in the elderly. And 75% were unaware of treatments available for AMD. So I think there's a need for doing what we're doing here today, and it should have a broader reach. A lot of times the kids of people that have macular degeneration get involved. They want the genetic testing. So just the patient awareness, it spreads. And that's what this organization is all about, to try to make the public awareness, bring attention to it, and that way we get other players in the field to develop new treatments. We've kind of covered the wet versus dry, but I do love showing Mark's slides. And as we told you, the hallmark of the dry is these deposits in the retina. They occur down in the lower, deeper levels. And the hallmark of the wet is that you have some bleeding into the macula. So, really what we're doing with these new drugs, you've heard of Lucentis, Avastin, and Macugen, is those are all for wet macular degeneration. There is a leak, there is swelling. These drugs have become extremely useful, not just in macular degeneration, but also in diabetes, in vascular occlusions, blockages, things that swell the retina. These drugs work in those also. We use them daily. But the thing to remember is that when we're treating the wet macular degeneration, we're converting it back to kind of the pre-existing dry macular degeneration. So we can kind of get the wet back to dry, but now we're really at that point where we need some breakthrough treatments on dry macular degeneration. We have some supporting things that we've been talking about, but we need something that will actually even reverse that damage. And we'll be going over some of those other, you know, treatments that are coming up in the future here more in the afternoon. Go ahead, Mark. So the retinal pigment epithelium, this kind of back into the anatomy a little bit, that's what this disease is primarily about. And that's the pigment layer that's directly underneath the retina, and it's on top of the white part of your eye, the sclera, then the vascular layer, the choroid, a little separating membrane. It's like the visqueen in your garden where you don't want the weeds from down below to pop through, and that's like those blood vessels. When that membrane there, called Brooks membrane, gets weak and fragile, it can crack and fracture, and these blood vessels can work their way through. Now there's probably things on top that aren't as healthy that create this environment where that occurs. So we're trying to get at it from all those different factors to create better blood flow, circulation, oxygenation, get rid of the free radicals that are causing damage to this barrier membranes and the actual photoreceptor cells. So it's a multifaceted approach that really is the most successful right now. We talked about the photoreceptors a little bit, but you know, there's the rods and the cones are more concentrated in the central macula, more for color vision and sharp acuities. And in the peripheral part of the retina, the outskirts, then it goes more into the rods, which are very, very light sensitive, and they're for night vision, peripheral vision, motion, movement, things like that. And those cells, 110 million of them, are all wired into the optic nerve to about 1.2 million neurons. So that optic nerve is like a bundle of wire, like a wiring bundle. 1.2 million neurons that then go to the brain. 42% of all the nerves that leave your brain go to your two eyes. 42%. So 1.2 million neurons per eye that then go out and are interconnected to 110 million photoreceptors. So you wonder why we can't just fix it. It's more complicated than the wiring diagram of an F-16. So it gives you an idea of the complexities there when it gets damaged, when the system gets damaged. That Brooks membrane, we just mentioned that's that little layer of visqueen that plastic kind of, it's a very interesting layer, multi-layer, and it kind of creates the division between the vascular layer and what should be nearly avascular areas where your sight is carried out. But it has to get oxygen to the tissue, so the fact that it's permeable allows oxygen to go through here, as well as from the retinal blood vessels, also creates some interesting situations. Go ahead, Mark. So we've touched on genes and the light eyes and the fair skin, and you can kind of see it coming in. And then sometimes you'll see maybe a Hispanic, African American that has macular degeneration. You go, where did that come from? Well, sometimes you ask in the family, and they had blue-eyed Spaniards in their family, or maybe a black family had a white grandparent or something like that. So the genetics are interesting. We're getting much better. I think they're getting so much more relevant now because some diseases, some blinding diseases, have actually been cured using some of these genetic therapies. So I've been referring more patients with very severe eye diseases. I have a friend of mine who has 2 sons with retinitis pigmentosa, which after the genetic testing, it may not have actually been retinitis pigmentosa. So we're really labeling these diseases now based on the actual genetic information, and then it can go into a national data bank, and as some of the new therapies come up, they'll be scanning the data bank for that particular gene defect. So we're really coming into a time now where the gene and the genetic testing is also going to have associated with it different treatments and potentially cures for that. So I've been referring more patients, saying, to get their actual genetic profiles, because then they're in a data bank and they would be able to assess if some new studies or trials comes out, they might fit into those trials, which a lot of times people are interested in doing. And we're going to go over that a little more too. Risk modification. I mean, you got to be proactive, and that goes diabetes, macular degeneration, heart disease, cholesterol. We're going to cover a lot more of this, but I just really encourage you. I mean, just walking has a tremendous impact on your overall health, which has a tremendous impact on your eye health and your brain health and everything else that goes along with it. And we're going to cover this in the next talk quite a bit. We've talked about some of the vitamins, some of the early testing things. These are all ways to stay ahead of the disease and help you maintain your vision into the future. This, I think, we have to look at this. And again, when you're talking about cost to the medical system and you start looking at obesity and looking at smoking, all of a sudden you're whacking large chunks of the healthcare costs if this could be addressed in a very aggressive, positive fashion. But the problem with when we gain weight, and we all know that it comes on 1 pound at a time, is this increased systemic oxidative stresses. And we've been talking about the free radicals and that. And what those do is they just damage cells, and the body regenerates several billion cells a day, which is amazing. But it starts to get overwhelmed, and so you start getting more and more cells that get damaged to the point that they can't be regenerated and can't be repaired. So you want to try and decrease that load, that oxidative stress. And one of the ways you do that is by reducing your overall, body weight. Back on that one more. So, it's going up. Obesity has doubled in adults and tripled in children since 1980. I just saw a thing that said like 75% of men and 65% of women are considered obese in this country today. We've all had plenty to eat. That's one of the wonderful things about this country. It's treated us pretty well. But we may have gotten a little carried away. Greater than 130 million people in the U.S. are overweight or obese. Medical expenses related to obesity, $75 billion. That's in 2003, so that's gone way, way up. And then couple, like I said, cigarette smoking, some of those things, and all of a sudden you're taking large chunks out of the healthcare budget. If we can get at this in a preventative, proactive, very cost-effective fashion. This is kind of interesting. For every increase in the waist to hip ratio, Shakira's saying about this, I think the hips don't lie. And if your waist to hip ratio is increased by just 0.1, it's a 13% increase in the odds of early AMD and 75% increase in the odds of late AMD. So, these things are related. Your cholesterol is related. Your high blood pressure is related. So you got to address all those areas if you really, really want to get a handle on this. Obviously what we put in we have to burn or it gets stored. So reducing quantities of food often is the simplest solution, and increasing exercise. Cooper Clinic looked at 4 20-minute walks a week, and they found you get about 80% of maximum aerobic benefit. It doesn't take much. The body's very efficient, but you do have to move. You have to get active. If you have hip problems and knee problems, you might have to find a swimming pool or an exercise bike. But you got to move. If you move, you're going to reduce the amount of medications and drugs you're on, and you'll be taking less and less medication for the more steps you take. And they recommend a pedometer, American Heart, 10,000 steps a day, which sounds like a lot, but it does. It's surprising how far we actually do walk. Go ahead. Smoking, very much a high risk factor with a lot of things we know, but macular degeneration for today's threefold increase in all forms of macular degeneration, 2.4 increase in the dry, and 4.5 times the risk of having wet macular degeneration and bleeding. And if you stop smoking, it goes way down. It goes, I think, to like 1.2 times. So there is a benefit after a few years of stopping smoking and reducing your risk factors. We've talked about the vitamins and the vegetables. Again, this is being proactive with your health, and that's what we're trying to get across today, and that will also be covered more and more through the day. We've talked about the zinc and the vitamins and the air studies. Some of those things are going to be covered more as we go, but I'm just re-emphasizing that. The omegas and the fish oil and the flaxseed and your, it's the good fats in your system, very important as antioxidants, but also anti-inflammatory. Inflammation is kind of the common denominator in chronic disease, whether it's heart disease, macular disease, degenerative arthritis. So, right through the board, we want to reduce the inflammation in our body, and that has a lot to do with getting in a better healing state. We tend to kind of shift toward these very inflammatory state, and a lot of environmental and all those things, toxins, I think, play a role. But these are things you can do to reduce that inflammation in your body. Exercise also factors into that tremendously. So we've been talking about, like with the kids, some of those things, some of the children want to know where they stand in that, and I would say certainly when they get up in their 40s or 50s, it's not bad it's a good idea for them to get a good dilated exam, see if they have risk factors, the genetic testing, and I would say if any of those things are positive, again, they just need to get very proactive with it. I think the kids are going to be in pretty good shape. I think a lot of these problems that we still haven't solved will be solved in the very near future. But I would always like to get a jump on it with the kids, encourage them to eat their dark greens, the vitamins, the fish oil, so on, and so forth. And back to the website if you had any further questions. Thank you very much.